Imagine you're having a great picnic with your family, but days later, you end up in the hospital with extreme diarrhea, fever, and pain in the stomach. That is the sad, nasty truth about the Shigella bacterial menace hurting the United States right now. With over 450,000 infections each year and related healthcare costs of up to $93 million. This tiny microbe is, indeed, a grave public health concern. So let's look at what Shigella is, how it spreads, symptoms one has to be on the lookout for, and most importantly, how one can protect oneself and one's loved one from this silent attacker. Shigella is a genus composed of gram-negative bacteria. It contains, for species, 1. Shigella sane, 2. Shigella flexneri, 3. Shigella boydii, and 4. Shigella dysenteria. The general characteristics of these bacteria are that they do not retain the crystal violet stain used to differentiate between bacteria. They are facultative anaerobes, non-spore-forming, non-motile, and rod-shaped. They are closely related to Escherichia coli. Shigella bacteria cause an extreme infection of the intestines, also known as Shigellosis. Generally, symptoms appear 1 to 2 days following infection and may last up to a week. The most common is diarrhea that may be bloody or watery, fever, cramping, and feeling the urge to go to the bathroom when the bowels are empty. Severe dehydration may occur, especially in young children and older people. Children under the age of 5 are more at risk for shigellosis and can contract the disease in daycare facilities and schools. Travelers to developing countries and other areas with poor sanitation and men who have sex with men also have higher rates of infection. This is because it is more likely to come in contact with contaminated food, water, and unsanitary conditions. Shigella is very contagious, and just a few germs are needed for an infection. It mainly lives in the stool of a sick person and can spread from there to any other thing, including food, water, or materials that can transfer infection through touch. Where there is poor observance of hygiene, like in schools and daycares and crowded living, outbreaks are common. To prevent the spread of Shigella, adhere strictly to the following hygiene practices. Hand washing, to avoid getting infected. Wash your hands very well with soap and water, especially after using the toilet, changing diapers, or before handling food. Safe nappy changing. Ensure proper cleaning of the nappy changing area with a disinfectant. Precautions while swimming. Try not to gulp down the water in swimming pools, lakes, or other water bodies. Hygiene while traveling, if traveling internationally, especially in poor sanitation regions. Follow safe food and water guidelines and good hand hygiene practices. Sexual activity, if you have contracted or your partner has been infected with shigellosis. Avoid sexual activity at least 2 weeks after feeling better. Most people will recover from shigellosis within 5 to 7 days without antibiotics. The most important thing is to keep drinking, as diarrhea may lose many fluids. In severe cases, health providers can recommend antibiotics. Although some of the strains of Shigella are not treatable by common antibiotics. As such, it complicates and becomes more challenging to treat. Thus, prevention of its further spread is of utmost significance. Indeed, Shigella is one of those nasty bacteria that can invade and destroy your digestive system with its very intense and discomforting symptoms. Indeed, knowing how it spreads and taking some simple precautions with personal hygiene can keep you and those close to you safe from this infectious menace. Informed travelers, community members at higher risk, and parents know that their best defense against the tiny menace of Shigella is awareness and prevention. Keep informed, stay clean, and keep safe. Remember, the battle against Shigella starts with each of us. Spread the message, not the germs. Share the video with friends and family to inform them of things that may help stay healthy. Let's do it together, stop the spread of this deadly infection, and let's all live in a safer and healthier community.